June is Oral Health Month, and your oral health impacts really your overall health. So here with some tips on how we can actually maintain optimal oral health to prevent disease is Dr. Arlene Asante, who is a cosmetic and family dentist. Welcome to Great Day.
Thank you so much, Ellen. I'm so excited to be here to share a passion of mine.
Well, I feel like it's nice that there's a month specific for everything, and
yeah,
this month is our
absolutely.
oral health. What does that mean exactly? Is it everything there, not just your teeth? Everything in your mouth, I assume?
Absolutely.
Okay.
The one thing that I love sharing about dentistry is that trying to connect with patients and letting them know oral health is about your whole body. I think sometimes as people, sometimes we disconnect the two and we don't realize that everything that happens in your mouth actually also affects your overall body and your health.
That's so wild, because you always hear about, what is it, flossing is connected to heart disease. Is that the one that we know about?
I would say your gum health and how well do you take care of your teeth. Unfortunately, people don't realize that your dentist can see indications in your mouth that you might have diabetes, high blood pressure, cancer. And we also recommend those that are pregnant to please come to the dentist regularly, but also during that time during your pregnancy. So these systematic issues that patients have are definitely well connected with your oral health.
I would assume that early detection is always important.
Oh, absolutely.
Can we kind of like push a couple of those routine care, you know, what is it, every 6 months we're supposed to be seeing you? What are you recommending?
I recommend you come to the dentist every 6 months, of course, but your dentist will do an evaluation, and in some cases, unfortunately, if we have been naughty, we have to come every 3 to 4 months because you've been diagnosed with periodontal disease. Unfortunately, yes.
I recently switched from flossing to what everyone talks about, the water picks.
Oh, okay. I am old school. I think flossing is the #1 thing that we should do.
Oh my gosh.
But water pick, especially now with dentistry progressing as far as technology, different ways to add in improving our overall health. I do agree with the water pick as well. It definitely can help if you have crowns, if you have bridges, if you have implants, things like that. Then the water pick is definitely something that you should add to your overall routine as far as your oral health.
I keep doing the flossing, so I shouldn't have dropped that. All right.
Oh, you were trying to get away from it? No.
Oh.
Ellen, you got it.
That's probably why they were like, your gums are bleeding a lot. Okay, I know that what you eat is important too. We always think of the sugar and whatnot. Do you need to brush after meals, or how should our diet
Yes, we should definitely brush our teeth 2 times a day for 2 to 3 minutes. I am an advocate of electric toothbrush as well. I always joke with my patients, if you're still using a manual toothbrush, you are still using MySpace. Who uses that? You know, people are using different technology. So just like there's different technology on the market, as far as oral health, using a manual you can use it, yes, but I highly recommend an electric toothbrush. It has so many features that can improve your overall health.
Okay.
Yeah.
And then, so we need to be, what did the periodontal? What did you say?
Yes, periodontal disease is a disease that happens when we don't go to the dentist regularly. The bacteria begins to eat your bones, the health in your bones. Excuse me, the bones in your mouth, the attachments, the tissue that attaches the tooth inside the bone. So those things, because of the bacteria, the overload of that bacteria, it starts killing different things in your mouth. So it's the bone, it's the tissues, you'll see a lot of bleeding. And these are signs that definitely something is happening beyond just a good health or gingivitis.
Oh my gosh. Okay, well, let's
I
take
hope
care
I
of
didn't
it.
scare you.
I know. No, you just are giving us all the warning. You can always get more tips by following along on Instagram. It's Dr. Arlene Asante. Thank you so much for coming in. Appreciate it.